The 2023 Florida legislative session has come to an end with a few bills that are going to be very helpful to lots of people. In particular, medical marijuana is now going to be allowed to have recertifications done by telehealth. Also, multiple black farmers are going to be granted licenses for medical marijuana treatment centers, also known as dispensaries. Let's talk about it. Hey everybody, it's Dr. David. So it has now been well over a half of a decade since medical marijuana has been legal here in Florida. Now, you may remember back in 2016, it was on the ballot as a constitutional amendment, and it passed with flying colors. It's become even more popular as people have seen what benefits it has brought and how little negative impact it has had on people as well as on society. Now, one of the things that we have seen, and that was very frustrating originally, was the not allowing of recertification of medical cannabis patients via telehealth. We are allowed to do virtually everything else by telehealth, unless we can't help the patient out, unless we are face-to-face, hands-on. So like if a patient had an asthma attack, unless you had a Bluetooth stethoscope, we couldn't evaluate for that. But for something like this, where we are asking how symptoms are you feeling better? What other changes can I help you out with? That's something very appropriate for telehealth. Okay, now you may also remember that there were 10 diagnoses that were listed on that constitutional amendment. Things like PTSD, Crohn's disease, HIV/AIDS, Parkinson's syndrome, MS. And also, there was this additional clause that said other similarly debilitating conditions, which is actually what a lot of people are qualifying for. Because in my mind, and the way my lawyers as well as the state seem to agree, since I haven't had any pushback on this, a debilitating symptom is something that you need to do something for on a regular basis in order to overcome what you're dealing with. So whether it's talk therapy, physical therapy, medicines, pain relievers, psychiatric medicines, etc., you are debilitated if you have to go through something like that. And a similarly debilitated condition to those symptoms, to those conditions, were things such as anxiety, sleep disorders, violence, etc., in people similar to PTSD. People have all types of abdominal issues similar to Crohn's disease. And so that's how we are able to certify people who don't have just those 10 conditions. Now, originally, the reason why they claimed that telehealth was not permissible is because they had deemed a concern about redistribution for those patients, that they would give it to somebody else who doesn't have a license. Now, after everything had passed, there was a Board of Medicine meeting where I had spoken at, where I explained that made no sense whatsoever, because whether a patient is seen face-to-face in the same room or by video, if they chose to break the law and give it to somebody else, neither of those two office visits would have made a difference. It would have been the same thing. But unfortunately, they weren't listening to thoughtful ideas, and they did prohibit this. But this has been something for a couple years that's been brewing. I want to give Dr. Barry Gordon down in Venice and some of the other physicians who were so strong up in Tallahassee advocating, lobbying for this, and it has gone through. So, Dr. Barry, good friend, thank you so much for all of your work on this. Now, I knew right off the bat the reason why we needed telehealth is because, first of all, there are patients who would be dangerous to be driving long distances. Those who have seizure disorders. Some of my children with autism who couldn't be in the car for a couple hours. And we have patients who come from all over the country. Also, I then started to developing patients who were homebound, who were then in hospice, who were not able to get to the office just because they physically couldn't. Some of them we had to cut off because we couldn't see them anymore. It was so sad. It was so tragic. But now we will be able to do this. So it's as of July 1st. That is when the law is going to go into place. We still haven't heard what the actual rules and regulations are, so we'll have to sort through that once it gets through. But at least we know that this is something that, assuming that Governor DeSantis signs it, but he hasn't given any information that it wouldn't. And this is a bipartisan thing, okay? Overwhelming, near unanimous support in both the House as well as the Senate. And so that's a really good thing that this is something that everybody has kind of come around to. Now, one thing about it, though, is that it's only if the patient is doing the telehealth with a doctor who they've seen already. So if there is somebody who is a new patient for that doctor, that patient would still need to be seen in office, which is still potentially a problem if you can't get to the office in the first place. But at least this is going to help a lot of people. Now, I have had some patients like, we still want to come into your office. We like being there. We like hanging out. We like the staff. We like the environment. And that, of course, will still be allowed. But it's great that we're going to have another option. Now, the second thing that passed that I mentioned is that back a few years ago, there was a push to help Black farmers gain medical marijuana licenses for them to grow, distribute, sell, all of that. And there were 12 applications that had gone through, and there was supposed to be allowing for one. Now, it ended up getting caught up in all kinds of litigation, and it actually never went through. So as of now, it's 0. But what the legislators voted on and approved is they then decided all of the 12 applicants that were originally there, as long as they met the minimum requirements in order to get an MMTC license, to become a distributor, sales, do all of that, they needed to hit these minimal requirements. But if they did, they would grant it to all of them. So they haven't exactly said how are they going to filter through to make sure all 12 of them still are legit. Maybe they will. Maybe they won't, but it sure is nice to see, considering some of the issues that we've had in Florida with who got granted the licenses in the first place. First round, it did seem kind of like a little bit of a, all boys club kind of thing where only certain people who had the connections were to get it. You had to be a farmer in Florida for decades to even be considered. So it's nice to see that if people who are qualified, that they'll be able to get this. Now, why are these two things so important? Of course, patient access. Patient access, being able to see their doctor. And in the case of the farmers, the more dispensaries, the more MMTCs that are out there, the closer that there will be for people to go get it, to be within the driving range of their delivery systems. And of course, the more product that's available, supply and demand. If supply goes up, and demand will go up too. So that's one of the things that have been triggering these is that we need more dispensaries. In fact, there's another round of licensing that's going on right now, of which there will be 22 additional licenses on top of those from the Black farmers. So this should help keep costs down and supply more readily available. And in the end, that's a beautiful thing. So it's nice to have some good news. Have a great day.